All right. Well, good afternoon, everybody. It's Lillian here from the Cold Lake First Nations Health Center, and I'm here with Kristina, who is our counterpart working in public health. And we were asked to come by today and give you a brief update on COVID-19 and where we're at. So we're actually going to do a couple of different things. We are going to start with, again, just going over what COVID-19 is very briefly, who needs to be tested, who needs to quarantine, as those rules have changed a little tiny bit. We're going to speak a little bit about the variants that we're starting to see emerge here in Alberta. We're also going to talk about isolation and quarantining options available to you, and then we are also going to talk about some of the restrictions that are in effect here in Alberta as well. At the end of our presentation, we are actually going to be going to visit with one of our community members who was very affected by COVID-19. And so we'll be doing a live interview with this individual at the end of our presentation today. So please stay tuned, and I'm sure that you will find a lot of good information from what he has to share. So I will let Kristina start off, and she's just going to quickly cover some of the stuff that I'm sure you know after the last year of having to deal with COVID like the rest of us, right? We're all sick of COVID, but I still think it's worth going through. Just as a good reminder to everybody that we are still living in a pandemic. And although it seems like we just about have it under control, this is not the time really to become complacent. We still need to double down on our restrictions. We need to make sure that we're following the protocols. And so that's really what we wanted to reiterate to you today. So Kristina, I'll let you start off.
Hi, good afternoon. So I'm just going to remind everyone of just what the core symptoms of COVID-19 are. And if you have any of the symptoms such as cough, fever, shortness of breath, runny nose, or sore throat, those symptoms require you to isolate for a minimum of 10 days if you have no pre-existing illness or existing health condition. So if you have these symptoms, you can come to the health center and get tested. And if you do test negative and have no known exposure to COVID-19, you're still legally required to isolate for that 14 days if you have those symptoms. Correct? Okay, yes.
Yeah.
If you have tested negative and you have no known exposure to the virus, you are not legally required to quarantine until those symptoms are gone.
So that's a little bit of a change.
Yes.
So whereas before we were saying to every Albertan was that if you experienced any of those core symptoms, you must isolate for 10 full days or until those symptoms disappear. And so what the change has been, although a small change, is if you have any of those core symptoms and you have a negative test, then you just have to wait until the symptoms disappear. You don't have to wait the 10 full days if they disappear before then. That's basically what it's saying.
Yes. But also be mindful if you have young children at home and they have any of these symptoms, please keep them home from school or bring them to the health center to get tested.
And quite honestly, we list the core symptoms, but for some people, they've shown up with just a stuffy nose and tested positive. So what I really want to encourage the community is if you are having any change in your health at all, so if you are experiencing a stuffy nose or congestion, and you're thinking it's just a cold, you know what, it's a quick swab. You're better off to get tested and know for sure what we're dealing with so that we're not spreading this throughout the community.
Mm-hmm. Even loss of sense or smell or taste, please come to the office and get tested.
Absolutely.
So if you have any, or you live with close contacts of a confirmed COVID-19 case, then you are legally required to quarantine for 14 days from that time you were exposed to that individual. You then please monitor for symptoms of COVID-19. You can also come to the health center and get tested. Even if that result comes back negative, you still have to quarantine for that 14-day period. If you are living regularly with that contact and they're isolating in a separate room where they have a separate bathroom, separate bedroom, then
so no contact at all. So if you're able to ensure that you have no contact at all with that same person in your household, then your quarantine time can start at the same time as that individual. If, however, you do share a space, right?
Yes.
So if you do share that space, maybe I'll just have you read about sharing that space.
I know this is all very confusing, but okay. If you are unable to completely isolate with a separate room, separate bathroom, then every day is considered a new exposure date. So how that works is you have to quarantine for that full 10 days as that active case does, but then your additional quarantine starts at that 10th day of that positive case. So then you have an additional 14 days after that. So I guess in essence, you are in quarantine for 24 days.
Yes, and I think that's where a lot of confusion came along in the community, is that, you know, if you're a family and you have children who tested positive because they were exposed at school, and then you were told to quarantine, if you were having ongoing interaction with that child, which most families do, because you can't quarantine your child to a room, because unfortunately that just doesn't seem to work in some of our households, and especially with some of our younger kids. So if you're having that ongoing contact, then that's why at the end of your child's recovery time, so on their 10th day, basically your quarantine time starts, because that's potentially the last day that they may have transmitted the virus to you. So I hope that kind of clears up some of the confusion as to why some people are isolating at home for longer than the 14 days. And in fact, it can be that way and has been that way in multiple homes on our nation. That being said, we now have a new thing to kind of throw at you. We've been tracking now some variants in Alberta. So currently, and I say currently as in February 20th was the last date of it that was available to me, we have exactly 278 variants circulating in Alberta. We have 114 variants in the Calgary area, 109 in the Edmonton area, and 55 in the Central. Currently, we do not have variants identified in the North or in the South zone. So these variants are definitely variants of concern. We're looking in Alberta, we've identified both the United Kingdom variant, or the UK variant, and the South African variant. So these variants are, what we know from the research that are out there, is that these variants are much more transmittable. So when we're looking at quarantining households, and let's hope that we never have to do this on our nation, but we have to quarantine variants a little bit differently, but almost a little bit the same. Household contacts of variant cases. Do you have that on your sheet there? I'm going to get you to go through that.
So I'm going to read this. It says, even if the case can isolate at home with a separate room and with access to a separate bathroom, this may not even be enough to prevent the transmission to other members of the household. So every day that the case is isolated at home is considered a new exposure to the household contacts. So then again, even if you can separate completely, you still have to isolate, end up being about 24 days.
Yeah, so household contacts of variant cases must quarantine during the case's isolation period of 10 days, plus the additional 14 days after the case's isolation period ends.
So these are for people that have had swabs and they come back negative, correct?
No, these are for people who have had swabs and tested positive.
No, for their contacts.
Oh, for their contacts. For their contacts,
I
yes.
just wanna clarify that.
Sorry.
No, it's fine. And if
See,
they remain
even we
asymptomatic-
still get confused and have to talk this stuff out. So the variant cases here in Alberta, we do know that we're looking at about a 70% more transmittable virus when we are looking at variant cases. Again, we are looking at not just having people quarantine in a room by themselves and that being effective. If you're sharing a household at all with a variant case, you will all be quarantining, as that is not considered enough inside the home, even with wearing the masks, doing the social distancing, and following hand hygiene protocol. So I guess what I wanted to emphasize to the community is right now is the time that we need to double down. If we are to look possibly or potentially at what they're talking as being a third wave, that third wave will be composed of most likely variant cases. And so we really need to start looking at our households, who you're letting into your home, and how long that they are staying there for, and if you're following those protocols. So to give you a little bit of more information on that, I'd like to talk to you a little bit about the restrictions that are in place. So all indoor social gatherings are prohibited, both public and private, at this time. So close contacts are limited to your household members only. That restriction has not been removed since December. So the only people that should be in your household are the people who live there. People who live alone can have up to 2 close contacts. These must be the same 2 contacts throughout the duration of these restrictions. If the close contacts do not live alone, visits cannot be held in their home. So single parents who live alone with their children under 18 years may be permitted to have up to 2 close contacts. And in regards to outdoor social gatherings, this has changed a little bit. So outdoor social gatherings are limited to 10 people maximum and must not have an indoor component. So backyard gatherings that require movement in and out of the home, let's say to use the bathroom, are actually not permitted during this time. Attendees should remain distanced at all times, even when outdoors, and must follow all public health measures. So that means wearing your mask, social distancing, washing your hands, or using sanitizer where appropriate. Now, if you do not have a household in Alberta, you must not stay in people's homes while these restrictions are in place. If you belong to a household, let's say that you have a student who's going to school in Edmonton, a post-secondary student, and they want to come home, that is permitted because that is their primary resident. But if you have family that, let's say, lives in Saskatchewan and they want to come for a visit, right now under the public health orders, that is still not permitted here in Alberta. Out-of-town visitors cannot stay in other people's homes while these restrictions are in place, regardless of where they are coming from. Okay, so again, just be really cognizant of who you're allowing in your home. I can't control who you allow in your home. You need to do that. And so making sure that you're stopping people at the door and saying, you know what, it's not really a good time to be visiting right now. And like I said, I can't control that, but you can. And I'm really asking you to do that. Because the one thing I don't want to see are these variant cases making a comeback on our nation. Weddings and funerals, the restrictions have lifted a little bit. For wedding ceremony and funeral services, attendance is limited to 10 people maximum for wedding ceremonies, 20 people maximum for funeral services, with mandatory masking and 2-meter distancing between households. So the households can be seated together. For those of you who are having to isolate and quarantine, there has been something new emerge in Alberta now. The Alberta government has actually come up with what they call the quarantine hotels. And these quarantine hotels are open for every Albertan, including those of our members who are both on and off reserves. So who is required to isolate and quarantine? Basically, all Albertans are legally required to isolate for 10 full days after testing positive, or you have symptoms of COVID-19 that are not related to a pre-existing condition, or quarantine for 14 days if you are a close contact to somebody with COVID-19. And those right there make you eligible for a quarantine hotel. So if you look on Alberta Health's website, you're going to come across a document much like this. It says COVID info for Albertans, and it talks about how do you access that hotel service. That hotel service can be accessed through 211. So basically calling 211, identifying yourself as having been told that you have to quarantine. And if you're not able to quarantine safely at home and you want to use the quarantine hotels, your name will be put into a queue and AHS will give you a call back. Now that process, I want you to be very patient. That process can take up to 4 hours for them to call you back. But rest assured, once you've given your name and your contact information, they will call you back and allow you to book in at the quarantine hotel. If you have any difficulties at all, you can always call myself or any one of us at the health center, and we can help you out with that. Finally, I wanted to talk to you about our vaccine rollout. So we have started vaccinating here on the First Nations. So we started our first vaccine clinic, I want to say that was on the 17th. No,
that was March 2nd.
on the 9th.
There you go.
I want to say it was on the 9th of February. So we've done 2 clinics. We have currently been offering to those who are 65 and older. So we have been through our list. We have offered to all of our on reserve 65 years old and older clients access to the vaccine. We have done this twice now. If you are 65 years and older and you have not been offered the vaccine yet, please give our health center a call. Our number there is 780-594-2473. You can speak to myself, Lillian, Kristina, or another lady by the name of Brittany, and we can all ensure that you get on the list to get immunized. We still have some doses left from our first rollout. I really do need to book at least 10 people at a time before I can use that vaccine. And the reason being is that we are given 10 dose vials. So I need to have exactly 10 people every time I open up one of those vials so that I don't waste any of this very valuable vaccine for our community. So please, if you have not been reached out to, please give us a call. For those of you who are located off reserve, we are looking at trying to get a plan together for you in conjunction with other communities. So please stay tuned. We do hope to reach out to you shortly. Okay, for all of you that are out there on the nation, whether you're on or off reserve, I do encourage you to please call and update your information with our health center, whether it be your postal address, your phone number, because Lord knows they change constantly. Please let us know how the best way to get a hold of you is, and we can update that information on our system to ensure that when it's your time, we have the ability to reach out to you. Currently, as I said before, we do still have some vaccine left, so we are now this week going to be reaching out to a good portion of our 60 to 64-year-olds, as well as those suffering from multiple chronic conditions. So if you are interested in getting that vaccine, please give us a call. We'll tell you where you are in that queue, and if we can get you booked, we absolutely will get you in and get you that vaccine. We here at the Nation are currently using the Moderna vaccine. This is a 2-dose vaccination schedule, so you get your first dose, and then it's 21 to 28 days later you will receive your second dose. This is not a vaccine that needs to be super frozen. Okay, it arrives to us in a thawed state, but that being said, it is only shelf stable for 30 days, so we have to quickly roll our plans out as quick as we can, and unfortunately sometimes we have to really rejig how we're doing our vaccine rollout depending on when delivery is available. So I still don't have word on our next vaccine delivery, and sometimes we don't receive word until right before it happens. But you know what? We're doing the best that we can, and I hope to roll this out to absolutely everybody the minute they give us the go-ahead that we can go and do that. It will be coming to you. And I really hope that for our community's sake and for the sake of our nation, that as many of you are considering taking the vaccine as possible. In order for us to really get back to life as normal, this is what must happen in order for us to achieve herd immunity, which is going to be really important in protecting everybody on the reserve. So please, if you are interested in getting your vaccine, give us a call. And I think that's pretty much about all we have for you. Oh, I did have one other thing. I've had a lot of questions as of late as to, what can we do in the way of gatherings and groups and stuff. And I know a lot of people were looking to the outdoors. There was another really good document available on alberta.ca called Outdoor Winter Recreation. And this is a guidance document for you in putting together things that go on outdoors. However, that being said, I do want to read about gatherings here. And it does say private social gatherings involving people from different households are still prohibited in any indoor or outdoor location in the province. For festivals and events, outdoor festivals and events, whether it be concerts, exhibitions, sporting events or competitions, fireworks displays, parades are not permitted at this time unless they are 100% in a drive-in format, and all attendees must remain in their own vehicles. So I hope that answers a few questions for you guys out there. If you would like, I can forward you the document on outdoor recreation, and we can put it out on the website here as well after we are through. So with that, is there anything else that I've forgotten, Kristina?
No, but if you have any questions, I know it's very confusing, so please give us a call and we can help reiterate the new guidelines, or just kind of go over the stuff that we have talked about in this
and
information
trust
session.
me, it's confusing for us a lot of the time as well. So sometimes just talking through your specific situation, it's a lot easier for us to explain and give you the rationale why your quarantine time is as it is. And I just want to end by saying thank you to all of our community members out there who have had to go through this. This is not something that people go out searching for. COVID unfortunately finds you. And so I really just want to make it really super evident that those of you out there who have had or been affected by COVID-19, our sympathies go out to you. Trust me, we don't put you into quarantine and try to keep you into quarantine, because there's absolutely nothing for us to gain from that.
Good afternoon.
But for those of you who have done this and followed our instructions and done it well, thank you so much for doing that. And like I said, this is not an illness that we go out to find. It finds us. And unfortunately, for some of us, it has affected us more than others. And so what we're going to be doing now is we're just going to be going into a little bit of an interview with one of our community members. This is going to be Rick Janvier, who's going to come on and talk about his experience with COVID-19. Rick was affected very early in December. And we're going to have just a little bit of an interview to find out what all the things that he went through and what his take on COVID is, as well as his recommendations to the community. I think you'll find this very interesting. So we'll take a break here and we'll go to our interview.
Everyone, my name is Rick Janvier. Everybody calls my name of birth is Ricky James Janvier. Everybody calls me Rick. I'm a member of Cold Lake First Nations, and this is my experience with COVID. I don't have any underlying issues, any health problems, whatever. But I'm going to tell you the real story about COVID and how has it affected me personally, my family, my finances, and everything. It's something you don't want to get. I'll tell you that right now. It's something, I guess I'm kind of plain stubborn at the beginning. How I found out at the beginning is I had place of employment. I had various places that I do employment. At one of those places of employment, I was exposed to COVID, where not myself, but a few other people obtained it and received it. I came back to Edmonton, where I currently reside with my family. Excuse me. The third week in December, I stayed at home. I was okay till about December 17th, I can recall, the night of December 17th. I went to bed. My partner got up, and I was sweating. I had a high fever. I don't know, but the temperature measured a little over 42. I was about 43. I was a point where it was so high. So my partner put lukewarm water in the tub, put me in the tub, and brought down my temperature. I sat in the tub for a little while till my temperature went down. I went to bed that night. I slept. There was no issue, no problems. Next day, I still had my taste and my smell. So it affects people in different ways, depending on their body and who they are. Next day, I normally had my normal food. I had 2 bowls of soup. I sat down in the evening. I was going to watch TV. I watched TV for a while, watching a movie. And all of a sudden, I don't remember anything. I just fell over from what my spouse told me, my partner and my stepdaughter. I fell over. I was talking incoherent, they told me. My spouse thought I was joking, fooling around, you know what I mean? I like to have fun and joke. And she thought, come on, Rick, come upstairs. Don't do that. And I still kept talking incoherent. Then my stepdaughter started crying, and she said, this is serious. We got to phone 911. So they contacted 911, and they came and got me within 6 minutes. From what I heard, they admitted me to the ICU. And from what I know, I don't remember anything from December 18th till about about a month, about 5 weeks, 4 to 5 weeks in ICU. They put me in ICU from recollection and from what I heard from my family and from the hospital. I guess I contracted pneumonia 3 times. First pneumonia knocked me out unconscious in a coma. I came out of it and I got a pneumonia again, so I wasn't taken care of. Third time, the third pneumonia, they incubated me to a coma so they can handle me. And they put me in a room with another gentleman around the same age as I am. And he had the same experience. So both of us were in ICU at the same time. And they call us the twins, I guess, from what the ICU was saying, because every time they came in, they flipped me and they flipped the other guy same time. They had to put us on the ventilator and put us on our stomach. And I don't remember anything. I just remember then they took me out after I got a little bit more control from what I heard. So I was semi-conscious. I can recall talking to my family through Zoom, whatever. I was talking to them, and I didn't know what I was talking about. They said, you know what I mean? I said my cousins came visit me. They had a motorcycle. I was very, very confused. I was very incoherent. I stayed there for a while, and I'm glad they had physio that time, because otherwise my muscles would have. I had atrophy. I think it's atrophy, if I can recall. Yeah, where my muscles they just relaxed. So within that time, to when they pulled me out of ICU, I lost 70 pounds, and that's something you don't want to experience. I'll tell you that right now, because it's hard. It's hard, and I'll tell you, when you don't have muscles and you're fat, and you're just basically by your bones, it's very difficult. So they took me up after I kind of came to a little bit more. They took me up to unit number 4. I was admitted to the Grey Nuns Hospital. That's where I was admitted. They're very professional and very personal, the nurses and the staff. In my experiences, that's probably one of the best hospitals where they can take care of you. And I'll tell you that right now, because they listen to you and they give you time. They'll give you some time. I like the nurses and the doctors. All kinds of people were there. I didn't realize how much I was affected by this COVID. And they kept telling me, the guy that was there is laying next to me. He passed on right next to me. I don't remember anything. And when I talked to the doctor, he said, there was 3 of us that were in a coma. 2 of them passed on. I was the lucky one. When I left ICU to go to the 4th floor, they clapped because they were excited and they were happy that I made it. But can you imagine the pain and suffering the families felt and the other people that passed on? It's unbelievable, man. It's something you don't want to get. I'll just tell you that right now. And you come to, they asked me where I was. I was very, very confused. I didn't know where I was. I thought I only slept for a couple of days, but here was 5 weeks later. I said, what day is it? He said, it's January 21st. January 21st? Yeah, I came December 18th. They said, you were very bad. At one point, they told me I had a 50-50 chance. I almost lost my life because of this. And I'll tell you something, guys. If you don't protect yourself and take care of yourself, this is something like I'm healthy as a horse. I have no problems, but it hit me differently. It hits people differently. And I'll tell you, when I came to, I was so weak. I couldn't even move. I lived on a nose feed for about another month. No, about a couple of weeks. I was nose feed. That's where I lost all my mass, whatever. I couldn't eat solid food. I couldn't swallow, even affected my swallowing. That's why I have a trachea on me, and that's to keep me breathing while I was there, and I had to have nose feed. And after they pulled out the trachea, as you can see, I got the scar there. It's a permanent scar. It's something of a reminder of what I went through. And while I was laying there, I thought I can get up, and I looked at myself. I said, "Wow, is this really that bad?" And it is that bad. I had all different kinds of professionals, medical professionals, come and talk to me. Speech language pathologist, dietitian. I can't remember, but all different types of professionals. I don't know how many different professionals come talk to me. One with swallowing, one with my heart, one with my muscles, one with my body, my mind and everything. I thought I lost some of my memory, but I'm so glad I didn't lose any of my memory. My memory is still strong. And when I left, from what they told me, said, "You're a very strong man," and that's very fortunate, because some of you guys, if you get that, if you're not strong as I was, you're not going to make it. I'll tell you that right now. Respect the rules. Listen to what's given to you, because if you don't, you could end up the same way I have, and that's not something you want to do. While I was there, I felt isolated. I was all alone because of the restrictions. My family couldn't see me, my relatives, my friends, nobody. I was all by myself except for some of the other people that were there after they pulled me out of ICU. The doctor came and see me and said, "I've never seen a man like you, very, very strong, like you went down." I was close to death, just a little point away. If I didn't make it, I wouldn't be talking to you guys today. But it's something that's got to be treated serious. And I'm being honest, look at me. I'm a living example. It's hard. My family cried. My mom cried. My cousins were all scared. My brother was scared. My sisters, everybody was just scared because they thought I wasn't going to make it. All my friends. But you know what? I have faith in a creator, in God. And they started a prayer for me. They started even before I heard when I was in ICU. I had prayers and friends right from California, right across Western Canada, right to even in Ontario, Toronto. I had some people right to BC, Alberta, Saskatchewan, Manitoba, and in California. And I'll tell you, prayers are strong. I think that's what got me through. And I'll tell you, and my will to live, but it's something you don't want to experience. And I think how I contracted before I got sick is, like I said, one of my places of employment. You know, I was stubborn. Yes, I wear the mask. I had my hand sanitizer, but I took off my mask to do the job I need to do. You know, and that's where I got exposed. And, you know, that's something I experienced. And then when I came to, like, I'll go back to where I was when I was on the 4th floor after he took me out of ICU. I had to learn how to walk again like a baby. I had to learn how to eat again. I had to learn, you know, I couldn't even write my name, and I couldn't even do anything. And I laid there in the hospital bed for years, and I mean, not for years, sorry, for days upon days. And it's something you don't want to have, man. I tell you, it's not, you can, I didn't have the pain, but my body felt the trauma. I had a tube and this was open. I had a big scar there, and they put it together. It's healed now, but there's a big scar to remind me, like I said, of my experience I went through. So after I was in a feeding tube for a while. They had to take me to get some x-rays on my throat. My muscles were so relaxed. I had to learn how to swallow again. I had to take exercises. I took those exercises. Finally, after my muscles got stronger, they kept x-raying me. I finally had a chance to swallow. And I was so happy I can eat again. But I lost 70 pounds. I'll tell you that right now, man. It's something you don't want to go. I was hungry. I was starving, basically. They had enough just to let me with the nutrients. And when I went through that, and then when I started eating, a little bit, they gave me little semi-solids like mashed potatoes, pudding, thickened juices, and all that. I kept doing my swallowing exercises. They finally moved me to a different room along with somebody else. I had my own room with somebody else. And then physio came, and I had to learn how to walk again. But I used a wheelchair for a while. I took small steps every day. I had the will and the determination to live, because this is something I didn't want it to destroy me or to take away, because I still have a life to live. I have a family. I have my spouse. I have my stepchildren. I have grandchildren. It's something that's very, 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 very difficult. So I started with the wheelchair. Finally, maybe about a week later, I started taking some few steps. And then I had a walker. After the walker, I said, I prayed every day, and I said, God, you know, I'm your servant. Yes, I know I've did things in life, but I need my health back, because I got to survive in this world. Because this shell is something that's really needs to survive in order to identify who I am. Because I'll tell you, folks, the people of Cold Lake and anybody, that this thing affects your physicalness, but your mind and your heart and your soul are still there. And it's from deep within inside that I dug and said, I can do this. I'll overcome this. The doctors and the nurses said, I wish all your patients were like you, to have the will to live and determine. I said, I am. I didn't stop. Within about a little over a week, I finally got off the walker. I started taking small steps, but my lungs were affected. They x-rayed it. I didn't have any effects, but I still had effects on my lungs because I was laying there. Every little step I walked, it was exhausting. As I walked more and more, finally I determined how to walk on my own. But it took about a month or so to walk on my own. And after I walked on my own, they finally introduced me again. I went to get a checkup on my throat. It started healing better after all the exercises and swallowing. I still do the exercises today and some of the swallowing. Now I can eat solid food. Now I can drink water and all that. But You miss that. I'll tell you, man, you miss that. It's hard. It's hard. It's something that's very, 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 very hard. I'm getting emotional here because it's something.
I don't imagine this was easy on you or your family.
Wasn't easy on anybody. Wasn't easy on anybody because I said I was on the threshold to going on to the other end, onto the other side, but I wasn't ready. So I've had other experiences in my life, but this is the worst one in terms of my whole trauma that I affected. And I'm going to be straight honest and truth, folks, and anybody that's listened to this video. Wear your mask, wash your hands, keep 6 feet apart. If you get it, stay home. Don't go out, don't do anything. Quarantine. And if you do, it's your choice. I made the choice. I didn't listen. I was stubborn as a goat, and look what I had to pay for. Now I'm cured. I don't have COVID, but the hospital had to cure me. I'm waiting to get the shots. I'm hoping the vaccination will help me. But I'll tell you, folks, this is no joke. Doesn't matter who you are or whatever. Like I said, I was healthy. It just hit me hard. It hit me hard. And everybody was crying. Everybody was affected. Everybody, my personal finances, my truck payments, my loans, everything was defaulted. I had to make arrangements. I'm slowly getting back, but it takes a hard time out of somebody. Finally, on February 17th, approximately 2 months before the day, I was released from home. It was last Wednesday.
Wow.
And within the week up till today, 5 days, I'm feeling better, but I'm starting to eat more. I'm taking my medication that's given to me. But it's something, I'll read it again. It's something you don't want. Take my word, folks, and I'm telling you the truth. Don't get exposed to it. You think it's a joke? Look, I'm a living example. I'm living here today. It's not a joke. How would you like to have a tube down your throat, ventilator in your face, and you don't know what's going on in your life? You know, I miss Christmas. I miss New Year's. I miss these celebrations. My grandson and my grandchildren, the twins' birthday. I wasn't there. It affected them a lot. Even my twins were missing me. When they seen me, oh, it was just a joy of jubilation. But it's something I don't want anybody to go through. And I'll tell you that right now. I don't remember anything from December 18th when I fell on the couch, got unconscious till about the 21st of January. But I was semi-conscious during that time. After within the 5 weeks, I think I was out of it probably 3 weeks steady in a coma. Until they took me out and they seduced me in another coma again to take care of the pneumonia. Mm-hmm. And I lost 70 pounds of weight. That's a lot of weight. When I weighed myself, and it came out first the beginning, I was weighing 204 pounds from 274 pounds.
Wow.
Within that time, after I started eating all that, I gained about 6 pounds. So I'm getting a little weight back, and I'm like a skeleton, but what they told me is you'll get your muscle back, but give it time. And I got exercises, and I've been doing those exercises. I'm starting to feel a little stronger, but during that time when I had to go through the physiotherapy, it's something I don't want anybody to go through. It's like being a child again, growing up and learning how to walk, how to eat, even how to write your name and speak. But our minds and our memories still know what our body's doing. And now I'm starting to write, starting to eat. It's just a recuperation. I'm glad I had some employee benefits. I still have income, so that's helping me to get back on track. But some of you who don't have that, it's something you don't want to go through. And we're lucky we're First Nations people, some of us, and we're lucky we have a treaty that'll affect us, because can you imagine what my medical bills will be if I didn't have the First Nations? They'll be astronomical out of this world, man, I'll tell you. But we're lucky. But I'm going to tell you, to avoid that, wear your mask, wash your hands, stay 6 feet apart. I didn't wear my mask one time. It got me. Look where I'm at. And it's something I don't want you guys to experience, but that's my story. And I'll tell you, it's a long road to recovery. I don't even know. I still got my jobs, but a couple of jobs I think I'm not going to go back to. I'm going to go back to my regular job. And my other job is radio bingo, which I do. But now when I don't get exposed to everybody, I'm just in the studio by myself. So I still have that job. with the other jobs I'm not going to have go back to. Just too many people with this pandemic. Until you get your vaccination. You get your vaccination, that's something you want to do. Because you don't want to go through this. I'll tell you that again. I'm going to reiterate it. You want the pain, the suffering, the family, the finances, how to learn how to walk again, how to speak again, how to eat again. It's nothing you want to go through, man. I'll tell you, it's something you don't want to experience. And I'm being honest, right from the heart. Look at me. I'm a living example. I'm skinny. I don't even have weight on me. I'm just like bones. But my legs are getting stronger slowly. My arms, my body's going to be getting better. I'll eventually be back on track, but it's something that's getting me to share with the people and let them know that this is real. This is not a joke. This is not a joke. I'll reiterate again. Take care of yourself. If you get the vaccination, do it. I'll tell you, I heard people die from this thing, but I'm sure glad the Creator was there and He gave me I don't know how many chances in life, but this is another chance that He gave me here to share my story and let you know that I still got scars from all my problems I had in life, but I'm a living example on this one, and that's something you don't want to go through. And I'm being honest, and I'm saying right from the heart. I'll read it again. Wear your damn mask, wash your hands, keep distance, and obey rules.
Yeah.
Because you don't want to experience what I went through. The trauma, the loneliness, the problems you had with, the family loneliness. The family gets crying. They don't know what's going on. Nobody couldn't contact. The only one I contact was my spouse eventually. My mom was lost. My spouse was lost. My family, my brothers, my sisters, my nieces, my friends, everybody was lost. Didn't know what's going on. Even my sister, she was on Facebook and they're telling her, how's Rick? How's he doing? And they finally told her that he's getting better. And now I thank everybody that was there that can hear me for their prayers, for, the strength in prayers and more people has kept me here today. I'm glad I'm walking this earth in this physical realm right now because I'm not done my job, but this is probably one of it. Just let you guys know this is my story and I'm going to stick to it. Again, listen to what I tell you. Don't heed the advice of medical professionals. Listen to the health units. Listen to what they say. And if you don't listen to it, that's your choice. I'm not going to say nothing, but look at the effects. And I'm a living example, just to reiterate to you guys. So thank you very much for giving me that opportunity to share my story. Lillian, is there any questions you want to ask me?
You know what? I just want to take this opportunity, Rick, to say thank you for sharing your story with our community, your family, because I do know that when you got sick and you went into the hospital, we followed your case quite frequently at the health center and what was happening with you and through your family. You are right. You are one strong man because there was touch and go with you for many times during that duration. We have the opportunity to speak with Margaret, who followed your case as well through your family members, and it was tough. And you know what? All I can say is that the Creator had something in store for you. And I think this is part and parcel to that, because I think your knowledge of what you've been through and to be able to share that with the community is so important, because I can talk till I'm blue in the face. But you know what? When it's somebody like yourself who has family here and has lived here and now has lived through this, you have a wealth of knowledge that you can now share with this community as to what you through and how to avoid going through this and your experience. And I think that in itself has been a godsend, because that's knowledge that people need to have. You know what? Not everybody has been affected like you, and thank the Creator that not everybody has had the experience that you've had. But you know what? Because you've had the experience you've had, you have the ability to give power to this nation through your experience. And I just so much want to thank you for that.
Thank you very much, Lillian.
You answered all my questions, Rick. You answered them bang on. So again, thank you so much. And is there anything else that you would like to add? Like, is there any other message that you want to share with this community or even with your family right now? Because for some of them, this might be the first time that they've seen you in a long time. So I want to give you the opportunity just to speak to your friends and your family here on the nation. So please go ahead.
Okay, just to let you know that, you got to have faith in yourself, respect who you are, understand. And then this is something I learned. The real self is within you. You got to take care of this vessel that the Creator has given you. The physical body doesn't leave. Just the real inside of you leaves, your spirit and your soul. What you do with this body, you got to protect it. And I'll tell you, my family, friends, relatives, whatever, remember, listen to the advice of the health professionals. They know about it. I was stubborn. It just took one time. That's where I'm at today. And I'll tell you, it's a slow road to recovery, but I'm glad I still have my job. I'm glad I still have the 2 jobs. I'm not going to go one job, the 2 jobs that I have. I don't think I'm going to go back for a little while till I get the vaccination and all that. But, my family and friends, respect yourself, treat yourself good, keep healthy, do what you got to do, and take the advice of the medical professionals because they know what they're doing. That's why they're professionals. If it wasn't for them, there'd be a lot of people we lost, or a lot of family and friends that we won't have here today. And that's what they're here. And you got the vaccination, take it. That's what it's there for. Because if you don't, if you went through the experience I had, some of you might not make it. Some of you have underlying health issues. It's going to affect you. But me, I was healthy, I was strong, I was very athletic. I like playing ball, riding my bike, playing basketball, playing sports in the summer, winter, whatever. And look where I'm at. Because one little wrong example, I didn't listen. I'm stubborn, but it's up to you guys because life is too short. And you can't live in this life without taking advice because that's what they're there for. We want to live longer. I want to live if I can to over 100 years old.
Well, you're well on your way, my friend. You've gotten through a hell of a thing with this virus.
Yeah, and I didn't expect it. You know what I mean? I didn't expect it. Some people might just get mild symptoms. Some people might be a little sicker, end up in the hospital. But I got the worst of it. I got the blunt of it, and it hit me hard like this. Boom. Mm-hmm. I fell over just one night. That's all it took. The night before, I thought I was getting better.
Yeah, thank God.
It hit me hard.
Yeah.
But like I said, family, friends, and relatives, and people of Cold Lake First Nations, take care of yourselves. Take the health advice. Again, I'm going to reiterate. Wear your mask. Wash your hands. Stay 6 feet apart. And listen to the advice of the health professionals. That's what they're there for, to protect us. Thank you very much.
Thank you very much, Rick, for sharing with us.
Thank you.
With that, I'll end our recording and our conversation. But you know what, Rick? Please take good care of yourself, and you are still in our prayers here.
Yeah, and if anybody wants me to talk or whatever about the experiences, just go to the health center and they'll get a hold of me, and we can make whatever arrangements need to be done. There's Lillian or Margaret or whoever the health nurses, and they'll contact me, and I'm more than willing to talk and let people know that this is a real virus, a real disease.
Yeah, and
some of us get it hard, some of us might not, but I got the worst of it.
Yeah. Well, and
I'm still living example.
Through that experience, Rick, maybe the more people will understand, and maybe more people will be more cognizant of their
right.
as well. So thank you very much.
Yeah, like I said, Lillian and everybody, just one little chance. Don't give that one little chance. Oh, I'll take my mask off, whatever. It's all it takes. Somebody sneezes, coughs, who's got that? You wipe your hands, touch your face. Sorry.
Yeah.
Again, I'll reiterate.
Practice all
Take care of yourself. Yeah, and thank you very much, Lillian. And I hope everybody have a good day and slow recovery, but I'll be back. Thank you very much.
All right, well, that was a very enlightening interview. I hope everybody got a little bit of something to take away from that. Rick, I really want to extend my greatest thanks to you and your family for providing us with the information that you did today. I hope that with you speaking to the community as a community member who has been directly affected by this, that maybe that will effect some change here in how people think about COVID and deal with COVID. Again, my deepest appreciation to you sharing your knowledge with us today. Thank you very much.
Thank you.